here to talk about some technical details with respect to hand postures. The specific hand posture we're going to speak about, it will be termed the yoke hold. Now you can term this anything you want, as long as it makes sense to you. Some people will call it a yoke hold, some people will call it a pistol grip, right? If you take a few fingers away, it really doesn't matter what you call it. The idea is that what you're doing is you've got a large contact surface that can be used in varying ways. So it can just be this surface between essentially the thumb and the index finger, or you can add in the palmar surface depending on what's going on. Now we're looking at our general concepts of broad contact for multi-point discrimination, and generally broad contact for control of safety. So this hand, right, can have a very large united surface. So if I'm going to palpate something, I can have a very large united surface. I can have a somewhat disjointed surface like this, right? So I take the thumb out so the thumb is free to wrap around. Or what I can do is I can use this and start to wrap around this way. So now this whole surface, as we spoke about, becomes my sensor, right? So I can wrap around and I can get multi-point information or multi-point discrimination. So here, I can show it with this hand, right? So I could just use the web, right, which is very minimal information, or I can wrap around the surface. I can do the same thing here, right? So if we go ahead and we bring the arm up just for demonstration purposes, I can wrap around, right? So now I have essentially the whole bicep surface. Now I have the whole tricep surface, generally speaking. The big deal is that we want to look at using our hands and molding to the anatomy. So a way that I've spoken about this in past in written form is molding to the topography of the anatomy, or the geographic kind of features. The idea that there will be rises and falls and turns. We want to be able to mold. My hand is a certain size, it's not going to change. My patient's anatomy in one area or another is going to change depending on who I'm working on. Therefore, what I need to do is use the dexterity of my hand and mold to the situation. The yoke hold is good for control of things, right? So I can control quite well. So if it's just on that yoke surface, it's good for control, but then if I use the palmar surface, I can get some pretty good control, right? It's also good, as we talked about, for broad contact for the purposes of multi-point discrimination. So anywhere that I'm contacting that I notice restricted motion, I can end up going to a finer sensory experience, so moving more towards the tip of the finger, which essentially goes with our concept of macro identifies micro. So this is the macro hand where I wrap around, and I can identify the micro surface or the micro area within that macro kind of viewfinder. So if we look at the hand as the viewfinder, I can go ahead and go from the large to the intermediate to the small as is needed. But again, that yoke hold. The yoke hold also is very good at working in ribs, especially in the mid-axillary line, because I can identify the rib, and in many cases, so I can get this in the interspace, the index finger in the interspace, and I can wrap around with the thumb behind. Does it always work? No, not always. Sometimes when the analog to this becomes my fingers like this, so I take the rest of my fingers, not including my thumb. Now if I do that, you'll see that there's a very marked difference in the length of my fingers. So if I wanted to work in between ribs, I would curve them so that they are now essentially the same length, and I can work in that interspace. So that's an example of taking the analog of that pistol grip or that broad contact surface and molding to the anatomy as is necessary. So if I can't appropriately identify the rib interspace with this because of the size of my hand versus the size of my patient, I can't mold appropriately, I can mold with a different tool, right? I'm molding to that. So the concepts we're presenting, obviously the yoke hold specifically, that's good for control because you can use a broad contact surface that wraps around, especially limbs and other portions of the body. It allows for multi-point discrimination. You can combine it with the palmar surface for an even broader contact area, but it has to mold to your patient. It has to be appropriate. So sometimes the yoke hold won't work. So you can move to a different hand posture, and we'll talk about hand postures a little bit more over time.